Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss few more mock questions from the CPC examination. Okay, so before that, if you are new to the channel, please support me by subscribing to the channel and please press the bell icon so that you will not miss any notifications when the new videos are getting uploaded. So, let's move to the questions one by one. First question, an infant who has chronic otitis media was placed under general anesthesia and a radical incision was made in the posterior quadrant of the left tympanic membrane. A large amount of mucoid effusion was suctioned and then a ventilating tube was placed in both ears. What CPT and ICD-10-CM codes should be reported? So here the diagnosis will be chronic otitis media. As mentioned, the patient is having chronic otitis media. Okay, and incision was made to the left tympanic membrane, and then a large amount of mucoid effusion was suctioned from both the ears. It's mentioned here both the ears, so it should be bilateral. Anyway, in our options, it's all bilateral modifier is mentioned 50. Okay, first let's look into the diagnosis. Chronic otitis media. Okay, what is the first diagnosis in the first option? H65.32. So just open the ICD code book and go to H65.32. What is H65.32 represents? H65.32 represents chronic mucoid otitis media left ear. Chronic mucoid otitis media left ear. You can just see in the question, chronic otitis media was placed and a radical incision was made in the left tympanic membrane. So it means the diagnosis mentioned here is of the left ear. Okay, chronic otitis media of left ear. But the procedure was done for both the ears. Which procedure? Mucoid effusion was suctioned. That is from the both the ears. So in the diagnosis, it is not both ears, it's only left tympanic membrane, which represents chronic otitis media of left ear. So our ICD code will be H65.32. What is H65.92? In the option B, H65.92. H65.92 represents unspecified non-separative otitis media left ear. No, this is not unspecified, this is chronic. So that option will not be the answer. And what is H65.112? In option C, H65.112 represents acute and subacute otitis media. Now this is chronic. So anyway, we got the ICD code as H65.32, which is there in options A and D. Okay. So let's go to the CPT code. What is CPT in option A? 69436. What is the CPT code for 69436? 69436 represents tympanostomy. Tympanostomy requiring insertion of ventilating tube under general anesthesia. And in the bracket it's mentioned there for my bilateral procedure report with modifier 50. So this is our procedure, right? Tympanostomy means large amount of, incision was made in the left tympanic membrane. Large amount of mucoid effusion was suctioned and ventilating tube was placed. That's also mentioned here. Insertion of ventilating tube. Anyway, let's check the other CPT code also in option D. 69421. What is 69421? That is myringotomy, including aspiration or eustachian tube inflation. No, that is not our procedure. This is tympanic membrane, which represents tympanostomy. Incision into the tympanic membrane means tympanostomy. Ostomy means incision. Okay. So our answer will be option A, 69436 with modifier 50 and ICD code H65.32. So let's move to the second question. A 2-year-old is coming in with his mom to see the pediatrician for fever, sore throat and pulling of the ears. The physician performs a brief history along with a problem pertinent review of systems. A limited exam was performed on the ears, nose and throat and respiratory systems. A strep culture means streptococcus, okay, strep culture was taken and came back positive. A diagnosis was also made of the infant having acute otitis media with effusion of both ears. The medical decision making was of moderate complexity with the giving of a prescription. What CPT and ICD-10 CM codes are reported? So let's find out the diagnosis first. Okay. What will be the diagnosis in this question? Here it's mentioned there. See, if you can see the options, for CPT codes it's only the E&M code, right? E&M code only is mentioned there. And rest both are the diagnosis. So first let's look into the exact diagnosis. What are the diagnoses mentioned here? J02.9 and J02.0. What is J02.9? If you can open the ICD book, J02.9 represents acute pharyngitis. And what is J02.0? J02.0 represents streptococcal pharyngitis. Here it's already mentioned there. A strep culture was taken and came back positive. Came back positive means streptococcus bacteria was present in the culture. Okay. And this child is having problem with the throat. See, fever, sore throat and pulling of the ears. Sore throat is there. So, our diagnosis which is related to the pharyngitis will be J02.0 because streptococcus culture was positive. So, it will be streptococcal pharyngitis. So, it will be either of three options B, C or D. Okay. Anyway, let's move to the other ICD, other diagnosis. What is the other diagnosis? Pulling of the ears. Pulling of the ears, see, otitis media. A diagnosis was also made of the infant having acute otitis media with effusion of both ears. So, it means acute otitis media of both ears, bilateral. Bilateral or acute otitis media should be the diagnosis. So, let's check the other from options B to D, the diagnosis. Let's check for the otitis media. What is H65.93? Only two diagnoses are mentioned. H65 it will be either H65.93 or H66.90. No, three diagnoses are there. H66.93. Okay, let's look into one by one. What is H65.93? H65.93 represents unspecified non-suppurative otitis media bilateral. This is not unspecified, it's clearly mentioned as acute. So H65.93 is an incorrect diagnosis code. What is H66.90? H66.90 represents otitis media unspecified year. Again, that is wrong. This is not unspecified, right? We have acute and unspecified. It's not unspecified year, it's bilateral years. So let's go to the other option. H66.93. What is H66.93? Otitis media unspecified bilateral. Otitis media, even though unspecified, we got bilateral. Here acute is not mentioned, but still compared to other options, bilateral. Otitis media bilateral is our diagnosis. So H66.93 is the correct diagnosis and J02.0 is also the correct diagnosis, right? So our answer will be option D. Still, let's look into the, what is the CPT code in option D, 99213. This is just an office visit. Okay, under the office visit itself, the doctor has done the procedure. So that's why there is no separate CPT code for the procedures. Only E&M code is mentioned there. and 99212 and 99213 both represents the established patient code. So we don't have a confusion regarding if whether the patient is new or established, because it's not mentioned in the question. Anyway, in the CPT code it's mentioned, like in the options, both the codes, CPT codes are represent the established patient. So what is 99213? 99213 will be expanded problem focused history, expanded problem focused examination, and medical decision making was of low complexity. So anyway, we got the two diagnosis exact answer as in option D. So you can mark the answer as option D. Since it is an office visit, only one E&M code will be there. Okay. So our answer will be option D. Let's move to the third question. A vulvectomy is performed on a female patient diagnosed with vulvar malignancy. The gynecologist oncology surgeon takes skin and deep subcutaneous tissue from approximately half of the patient's vulva as well as her inguinofemoral lymph nodes bilaterally. What are the CPT and ICD codes for this scenario? Okay, so let's move to the options and let's look into the diagnosis one by one. What is C52? See, even though in the question if it's mentioned bilaterally, don't think that option A and C will be the answer. Either of option A and C will be the answer, because 50 modifier is present only in options A and C. Don't think like that. Okay, it can be the other answers also, the other options also, because not all CPT codes contain bilateral modifier. Sometimes it's already included in the description of that CPT code. So be careful with that. Okay. So anyway, let's go to the diagnosis one by one. What is C52? C52 represents malignant neoplasm of, you can open the CPT code book, sorry, ICD code book. C52 represents malignant neoplasm of vagina. This is not vagina, this is vulva. Okay. This is vulva. Malignant only, but vulvar malignancy is present. Now, what is D07.0 option B? D07.0 represents D07.0. It represents carcinoma in situ of endometrium. Endometrium is the lining of the uterus, right? So that is also not the answer. What is D49.59? Diagnosis D49.59. D49.59 represents neoplasm of unspecified behavior of other genitourinary organs. This is not genitourinary. Like it's indirectly mentioned there. Anyway, let's go to the option D also. What is C51.9? C51.9 represents malignant neoplasm of vulva. Yes, that is our diagnosis, right? See, it's already mentioned in the first sentence. A vulvectomy is performed on a female patient diagnosed with vulvar malignancy. Means that patient is already diagnosed with vulvar malignancy, means malignant neoplasm of vulva. So we got the correct answer, right? Without looking into the CPT code itself, we got the correct option, correct answer as option D, because other three diagnoses in the diagnosis in the other three options are incorrect. So C51.9 is the exact diagnosis. So our answer will be option D. But still, let's check what is that CPT code represents. We need to look into only one CPT code, 56632. What is 56632? Vulvectomy. Vulvectomy is the procedure done, right? So vulvectomy, radical, partial with bilateral inguinofemoral lymphadenectomy. See, I told you before, this in the CPT code, it's already mentioned bilateral. So we don't have to code 50 modifier separately. Okay, so vulvectomy bilateral. So our answer CPT code will be 56632. That is also correct. So answer will be option D. Okay. Moving on to the fourth question. Mr. Jones is here today to receive an intercostal nerve block to mitigate the debilitating pain of his malignancy. His cancer has metastasized to his lungs. Quote the patient's condition. So this is only ICD codes. So what is mentioned in the question? The patient is here to receive intercostal nerve block to mitigate the pain, because the patient is having pain. So in order to uh, overlap that pain of his malignancy, he came to see the doctor. But his cancer has metastasized to his lungs. Metastasized means spread. So whichever part is primary part is there, it has been spread to his lungs also after the checkup with the doctor. So we have to quote the patient's condition. Okay. So we have to quote for the pain and we have to quote for the cancer. But which code should come first? The pain code, right? Because the patient came for the pain. Because of pain, patient has come to see the doctor. So we have to quote the G code first. G code is for the pain. So let's check all the G codes first. Which code will be the correct one? G89.3 and G89.12. Two options are there. Let's check one by one. What is G89.3? G89.3 represents neoplasm related pain. Yes, this is neoplasm related pain, right? Acute and chronic. Anything. It can be acute or it can be chronic. It's mentioned in the description. So this is neoplasm only related pain. So anyway, let's check the other one also. G89.12. What is G89.12? It represents acute post-thoracotomy pain. This is nothing related to thoracotomy. So our pain code will be G89.3 only, which is there in option A and C. Okay, so let's check only the other codes from options A and C. What is in option A? The other two codes, C78.01 and C78.02. What is C78.01? C78.01 represents secondary malignant neoplasm of right lung, and 02 C78.02 represents secondary malignant neoplasm of left lung. This has been the patient's cancer has been metastasized, means spread to the lungs. It means this lung cancer is a secondary cancer. Okay, so that's why our in our diagnosis it should be secondary malignant. It should be secondary neoplasm. What is the C codes in option C? C34.91 and C34.92. What is option C34.91 and 92? C34.91 and 92 represents malignant neoplasm of unspecified part of right bronchus or lung. No, our diagnosis related to lung cancer should be secondary. Okay, so correct ICD codes which is related to the lung cancer will be secondary lung cancer, which is there in option A, C78.01 and 02. In the question it's mentioned metastasized to his lungs. It means both right and left lung. That's why in the diagnosis also it should be separate, right lung and left lung. So our answer will be option A. Pain code should be the first primary diagnosis G89.3 and then the secondary neoplasm of lungs, left lung and right lung, both should be coded. So that's how you will get the answer as option A. Okay, G89.3 and C78.01 and C78.02. Let's move to the fifth question. Okay, Mrs. Emily, who is 83 years old, is being admitted for dehydration and anorexia. Probable cause dementia. She was brought in by her doctor, who is visiting from out of town. Her daughter will take her from our office to St. Mary's Hospital. The gerontology unit will evaluate her mental condition tomorrow after she is stabilized. How would you quote the diagnosis? Here also only diagnosis codes are that we need to report. We should report only the confirmed diagnosis. So what is there in the question? The confirmed diagnosis. See, the patient is admitted for dehydration and anorexia. So we have to code for dehydration and anorexia. And to make you confused, the other things are mentioned in the question. Means daughter is coming from out of town and she will take her to St. Mary's Hospital. She will take her means in future, means in the coming days. Gerontology unit means those who are taking care of the old age ones. Okay, so the gerontology unit will evaluate her mental condition tomorrow after she is stabilized. Only tomorrow that this procedure will be happening. Mental condition, to check the mental status, mental condition. Okay, so what is F code? Usually F code represents mental disorders. All F codes represents the mental disorders. So this that's why, to make you confused, they have mentioned a few F codes in few of the options. But we cannot code those codes because it is not a confirmed diagnosis, right? Only the confirmed diagnoses are dehydration and anorexia. So we have to code only dehydration and anorexia. Okay. So what is the code for anorexia? If we can check. See, F codes will not be the answer. So just eliminate all F codes option. A, C and D contains F codes, which will never come as the answer because the mental condition diagnosis will come in future only. It's not a confirmed diagnosis. So our answer will be automatically option B. We can find out like that. But still just check what are the codes in option B. R63.0. R63.0 represents anorexia and E86.0 represents dehydration. So these two are our diagnosis. So our answer will be, because it's the patient is being admitted for dehydration and anorexia only, right? So our diagnosis will be option, these two ICD codes only. So our answer will be option B, R63.0 and E86.0. Okay. So friends, that's all for today from few more questions. If you have any comments, any inquiries, you can always mark it in the comments. And if you are new to the channel, please subscribe and support me. Please like, share, and you can press the bell button for getting notifications whenever the new videos are getting uploaded. So stay tuned for updating of more chapters. I'll be coming back with more ICD chapters and guidelines in the coming episode. Okay. So thank you so much for all of your support, and bye bye. Take care.